glorious Edo. You're the heartbeat of Nigeria. Beautiful Edo, glorious Edo. Stars are singing over you. You're the land people dream to be.
The Executive Governor of Edo State, His Excellency Godwin LEGACIES of Obaseki, invites the general public to the launch of the rebuilt and expanded 250-bed ultra-modern Stella Obasanjo Hospital, Benin City. Keynote speaker, His Excellency President Olusegun Obasanjo, GCFR, former President Federal Republic of Nigeria. Special guest of honor, Her Excellency Dame Patience Jonathan, former First Lady of the Federal Republic of Nigeria. Followed immediately by the commissioning of the Edo State Secretariat Food Court and Creche by Her Excellency Patience Jonathan. Date, Wednesday, 6th November 2024. Time, 10 a.m. Venue, Stella Obasanjo Hospital, Country Home Road, Benin City. Signed, Godwin LEGACIES of Obaseki, Executive Governor of Edo State. Edo, another promise made, another promise kept.
Glorious Edo.
The system we met was one where you had a central or general hospitals where everybody went to for care, which is not feasible, especially as the urban areas were expanding rapidly. Benin City alone occupies almost 40 to 50,000 square kilometers of land. We thought it otherwise, that if you are ill, you don't have to spend 1 or 2 hours to get to a point of care. We felt that for convenience and for easy access, that each neighborhood, each ward, or each political ward should have at least one primary healthcare center, such that citizens don't have to travel beyond a certain distance to be able to access healthcare in their communities. We have fiber optic connections to most locations where you have primary healthcare centers. And because we already have our staff trained in the use of technology, we have been able to build the capacity to have remote consultations from doctors either in major urban areas in the state or in the country, and all doctors even from abroad. We have Nigerian physicians who live abroad who manage patients and cases in their localities in these primary healthcare centers using technology and fiber connectivity, which we have in them.
So we came up with the idea of the STREAM initiative, which was an acronym for our strategy to delivering what was the mission to make primary healthcare an entry point into the health system. And what was the STREAM initiative? It was staffing. We knew we needed to improve on our staffing. It was use of technology, because I mean, in the 21st century, you can't be talking about anything without technology. Arrow there was for renovation. We wanted people to embrace the concept, and the primary healthcare space we met was that of primary healthcare was for the poor, for the for the rural. So we wanted to build beautiful structures that everybody can access. So that arrow was for renovation of infrastructure. Then E was to enhance our equipment. So most of the equipment we inherited had long been there. Some of them as long as 40 years, 30 years, probably maintained. So we knew we had to maintain and buy new ones. And then the A was the alternative power. Like we know, our national grid had broken down, so we started to solarize our services, put solar panels in all our facilities that we're renovating. And then the M, which oftentimes is not looked upon, but it was management. So we brought in quality management system as well. We started writing SOPs and putting standardizing our process, and we're still on that journey. So that was the STREAM initiative that we brought in. to help guide our approach towards primary health care. And so far, on each of these stations, we've brought in new ideas.
Prior to what you're seeing today, we used to have just a few blocks as the local primary health care centers. We didn't have any consulting rooms, neither did we have any space for immunization or infant welfare clinic. We only had 3 bed spaces for patients' admission. But however, we were still able to pull up a lot of activities which merited us being upgraded by the state government, and we got this new building. Now, in this new building, we have 2 consulting rooms against when we didn't have any consulting room. We have a spacious hall for our immunization and child welfare clinic, for our antenatal activities. Then we have 2 wards. One is the maternity stroke female ward, and we have a male ward. The male ward is a 5-bedded ward, while the female ward is a 9-bedded ward. So in total, we have 14 bed spaces for patients' care. Then we have sectionized pharmacy and a lab, unlike before when these spaces and these activities were not specialized, right? Then we also have a theater, a fully functional theater, where we have a theater bed, we have theater monitor, we have oxygen concentrator, we have the equipment we need for basic theater cases, that's surgical cases, right? Then we have more equipment now to work with. The staffs are happy to come to, when they're at work. This environment is conducive for healthcare workers to discharge their duties. And not to fail to mention that the patients too, they're happy. We've had more clients inflow. People are coming from far and wide.
We do antenatal services, delivery, immunization. We render treatment of minor ailments and diseases, and all other health services are inclusive, including family planning. And these services have been made free for the general public to come and benefit. So we thank everybody that is coming. I also thank the government for giving us this. We are truly grateful.
I've been coming to this health center for the past 3 or 4 years now. I gave birth to my 3 children here. This is where I come from antenatal. Their service is okay. We are enjoying 24 hours light, 24 hours water and free Wi-Fi. The nurses and matron, they are well mannered. So their service is 100% okay.
Everything was okay. Now here I register. Now here I born. They attend to me well. They attend to me well. During my pregnancy, my antenatal time, they attend to me well.
For this health center for here, they take up for us. And the patient where they collect a free treatment. Anytime where I come here, say I'm nowhere, they will give me free medicine. They will attend to me. If I to test, do test, they will do test for me. No time where I come here where they know they attend. I just like this health center.
You have the Primary Healthcare Development Agency that is co-funded between the local government and the state government. So the staff are now autonomous. They are now staff of the agency and no longer are not of the state or of the local government. And I believe the state government pays 60% of the cost of running that agency. The Stella Obasanjo Hospital, which suffered many years of neglect, has been rebuilt and revamped to a world-class medical facility. This hospital, which easily ranks as one of the largest in South Nigeria, will boost medical tourism in our state. thank the people of Edo for giving me the opportunity to serve these last 8 years. The Edo State Broadcasting Service has been rebuilt and re-equipped with state-of-the-art technology. This clearly has improved the quality of broadcasting from this station. I thank the people of Edo for giving me the opportunity to serve these last 8 years.
Edo State is embracing a new dawn of renewable energy with a special focus on solar power. As part of its commitment to sustainable development, the state is investing in initiatives aimed at providing clean energy to communities.
We started with 50 mini-grids. The first rollout was 10. Which, by the grace of God, we were able to establish this 10.
The Edo State Commissioner for Mining and Energy, Ojefo Enahulo, says the focus on solar energy is a game changer for Edo State.
Today, I can tell you boldly that Godwin reform on the energy sector is one of the best in Nigeria, because this is the first time in the history of the state that we're able to establish 9, now approximately 10, because the other one is just about 85% completion, 10 mini-grid across Edo. We have a master plan, we have a policy we have designed, and we have a committee we have set up to light up Edo. So we are putting Edo into 3 different segments in the new electricity market, which is the Edo North Electricity Company, the Edo Central Electricity Company, and the Edo South. And if you see the way we are positioned as a state, you discover that we have manifold of these gas stations, gas manifold centers across the 3 central districts. That simply put us in that space that we can generate more power using the gas project. And remember that the contract had been signed by the Ondo Energy to also power with the wind project, which we're already doing some feasibility studies around Ohumode Axis. So we are going to add more energy to the ecosystem and make sure the entire 3 central district are covered. And we are not stopping there. Obaseki is also the first governor in Nigeria to do a mass military project, because while we designed the master plan to power the entire Edo state, we're also looking at the best way to do the recovery for some of the investors that will be coming in. And we look forward to now cut that cost of military, because pay as you go is the only way now. So we set up that, we roll out that program, Operation Meter Edo. As I speak to you now, over 1,000 houses have been connected by BDC. We are working closely with the existing discos. We want to support them, we want them to work with us, because as of today, Edo State is now self-regulator of electricity. 21st of August, we received that approval and that oversight from NEC, and we're happy about that because we have been pushing. We're also the first state to design electricity law 2022 year, July 22nd. We have our own state electricity law, but now we have amended our electricity law. So we have a standard and a uniform electricity regulators we have set up to work with the existing DISCOs and GENSCOs. We're also having a good rural electrical agency that will push forward these implementations.
Solar power projects are set to illuminate rural areas that have long been underserved by the national grid. These initiatives not only provide electricity, but also promote local job creation.
In the power sector, we classified it into 2 different segments. One was the normal gas to power project, which the governor perfectly delivered to us by the Osoma project. And the other one is the renewable energy master plan. So the governor set up a renewable energy master plan to power the rural areas. We're able to gather some statistics about 104 communities are unserved. And we also look forward to health institutions to see how we can power them as well. Obaseki also launched the SME Renewable Energy Project. As I speak to you now, we are setting up renewable energy project across small businesses like the churches, the barbering salon, the private hospitals, maybe a bar, a restaurant, a hotel. As of last week, our team went to Auchi to gather some data on some hotels that need to be powered, some churches that need to be powered, some private hospitals that need to be powered. We have some partners we are working with. Obaseki opened up the system for good investors to come into the renewable energy space, not just for only state or federal institutions, not just for state and federal hospital institutions, but strictly for also for private institutions, churches, as well as hotels and beer parlors, restaurants, barbering salons, small businesses, printing press and all that. So we want to cover this space. We want to be the first in Nigeria. As you know, we are almost the first state to launch out that renewable energy project. And by the grace of God, we have done so well in the energy sector.
The Edo State government, true to its pledge of providing solar power for rural communities, has set up a mini-grid solar farm in Enyai community. This grid generates 275 kilowatts of electricity and powers over 80 homes with 24 hours electricity. It is one of 50 of such solar farms that will be built, the largest solar farm in Edo State.
We started with 50 mini-grids. The first rollout was 10. Which by the grace of God, we were able to establish these 10. One was located at the community, one at military hospital, one at Ohobe community, 1.5 megawatts, then one at Ira Specialist Hospital, 1.5 megawatts, one at Ewohimi, one at Uwoha, one at Auchi, so across the 3 senatorial districts. So what we want to achieve is just to support the existing infrastructure and also to target those major unserved areas because the cost of infrastructure was very high. We're also putting one at the Auchi Polytechnic because we discovered the cost of energy there was only about 54 million monthly on both the AGO, which is the diesel, and both the BEDC. So we want to support that system to reduce the cost of energy. 10 years from now, 5 years from now, 2 years from now, Edo will be self-sustained because we want Edo State that everybody will pay as you go. We don't need to start dragging it from home. We also set up Edo State electricity monitoring team, comprised of the police, the DSS, the army, the FCC, everybody, to counter and to control electricity theft. We also designed that platform, all right? We are doing that already to control that particular misnomer. But what we want to do is to make sure the investors and developers that are coming to Edo State able to understand and develop the system that will work for the state first and also that will work for them in the terms of profit. So far, Oshoma is doing well. So far, the mini-grid from America that work with us, they are doing well. All the major investors we have in the energy space, they are doing so well. So they are making that profit because everybody needs energy, including yourself. You affect entirely the profit of every business. So if your energy is going down, like the church we are trying to do about 500, close to 1 megawatt for, they are telling us at the end of the church service, they intentionally donate money again for EGO. Just to power the next service and power the next service and all that. So we are trying to support that system. I think this is the first of its kind in Nigeria, and I must applaud our distinguished and also our father, which is the governor of the state, for putting forward this laudable project for Edo people.
As these solar projects come to fruition, the ultimate goal for the Edo State government is to be the pace setter in renewable energy in Nigeria, setting an example for sustainable development, ultimately creating its own independent power supply. Edo State is on the path to energy independence, leveraging on the power of the sun to illuminate lives and foster a greener future for residents.
With our Edo State Production Center, we've nurtured and grown small and medium-sized businesses. I thank the people of Edo for giving me the opportunity to serve these last 8 years.
In the years preceding Governor Obaseki's tenure, welfare of pensioners was nothing to write home about, as the senior citizens who ought to be resting after serving the nation meritoriously were seen on the streets of Benin City, particularly at the city center under the sun and in the rain, protesting payment of their entitlements.
Anyway, before the present governor came on board, there were a lot of problems arising from late payment of pension arrears, going up to 30 months, 40-something months unpaid.
Now, with the reform in the civil service, this is no longer the situation, as Governor Obaseki introduced the contributory pension scheme, which has assisted in laying the groundwork for sustainable and effective pension administration system.
So under the contributory pension arrangement, the government puts a certain amount aside and also gets the workers to match that savings, and it's now put in a separate fund and accrues, and these funds are invested over time, such that by the time you finish working in 30 years or so time, you have acquired and accumulated quite a bit of savings, which is now available to be used as payments, as annuities or pensions to you when you retire. Effective January 1, 2017, EDO cut over into the contributory pensions arrangement. We then decided to now make savings every month to take care of these outstanding obligations. First is the regular pension and the pension arrears, which we met, which we cleared, and also the gratuity, the lump sum that you get paid when you finish working. Because once you finish working, you're supposed to calculate and pay you a lump sum for you to restart your life, and then pay you pensions on a monthly basis. And these commitments came to almost 38 billion naira. To date, we've been able to clear all the pension arrears, and we have been able to pay almost 12 years of gratuity outstanding. I believe that the next administration should be able to clear the outstanding gratuities left.
From 1979, that was the period they have been owing this money. His Excellency called the council chairman then, and the 18th council chairman started saving 100 million naira monthly. We have cleared arrears of salaries, death benefits up to 2011.
Contributory pension scheme comes with life assurance. What that means is that for every person who is on the contributory pension scheme today, he is life assured. And government has to pay the premium every year. That's some cost additional to the cost of paying salaries and all of that. So all of these are actually a disincentive to many governments. So you're struggling to pay salaries, and then you're also looking for how to set aside 10% and all of that costs you to deal with all those fallouts from the contributory pension scheme. That's why today only about 5 states or 6 in the federation are faithfully on the contributory pension scheme, and we're one of those states.
I retired 2010. His continual payment of pension to me has given me release. I can eat what I want to eat, put on what I want to put on. Associate, no more come to this I cannot because there's no money in the pocket. But this time, before you finish, another one comes. So it has affected me in a very positive way.
When you retire in January, you start your pension in February. You don't have to wait for months before your name is being put into pension payroll. But before I retire, I know it was there. There are people spend 12 months, 13 months, even some 15 months before their name are put into pension payroll. They suffered a lot.
Present administration, when we were about to retire, he even promised us right from that very day, that very month that we are retiring, we will start paying us. And ever since, he has been alive to his bidding.
We have been able to see that there is nothing, no government have been able to pay attention to personnel than this very much.
In fairness to the governor of Edo State, he paid before the time.
In the past, some pensioners died as a result of trying to do their screening. So we introduced the online screening, which have been implemented at the state level. So the process is going on now, whereby pensioners can do screening online without stress, unlike what we used to have before.
The last time government incurred pension liability was December 2021. So from January 2022 to date, all those that have retired went away without government owing them a dime. I know Governor Godwin Obaseki very well. He is going to do a comprehensive handover. They need to read through it. They need to see what he's doing.
The decision of the entire Edo State NUP Executive Committee to give special award of recognition to our amiable, record breaker, indefatigable governor, His Excellency Godwin Obaseki, as the most pensioner-friendly governor in the history of Edo State, is our little way of showing appreciation to someone who changed the face of governance in Edo State.
Your Excellency, it is my honor to present you this little gift to show our appreciation for your excellent work.
May the labors of our heroes past never go in vain. Because if you do not appreciate and extol what people who came before you did, then God Almighty may not be so favorable to you when you leave. That's why I want to thank God for the opportunity that He has given me to serve and to see some of the things that have not been done right and to try and make them right.